If you value your health, your confidence, and your future, this video is meant for you. I'm Dr. Girag Mihai, an expert in urology and men's health. And today, we're covering 10 things you must never do to your penis. These aren't just suggestions. They're critical tips to help you remain safe, healthy, and sexually confident for years to come. If you're new here and passionate about staying strong, healthy, and informed, pause for just a second. Hit that subscribe button and tap the bell so you never miss another men's health tip. That could literally change your life. Now, let's get started. Number 1, don't ignore your penis. Your penis acts as a strong indicator of your overall well-being. In truth, research reveals that men who experience erectile dysfunction are far more likely to suffer a heart attack within 7 years. That's because the blood vessels within the penis are tiny, and any issue with blood flow usually appears there first. Firm erections signal that your circulation, hormones, nervous system, and mental health are functioning properly. So when anything starts to shift, don't dismiss it. Take notice. Seriously. Number 2, don't attempt to solve issues with risky home treatments. I've seen it all, from men applying apple cider vinegar for enhancement to DIY tools made from soda bottles and metal washers. Please avoid this. These approaches may cause serious damage, including nerve injury, scarring, or even permanent erectile dysfunction. One example is jelqing, manually stretching the penis to lengthen it. This frequently results in micro tears in the tissue and long-lasting injury. I've had young men show up in my clinic with lifelong complications due to this. Another hazard, makeshift constriction bands. I've treated patients who landed in the ER after using bottle caps, metal fasteners, or rubber, ties they couldn't remove. Some even needed power tools to take the item off. If you ever use a constriction ring, buy one that's medically approved and easy to release. Number 3, keep your penis appropriately clean. This might sound basic, but it's often overlooked, especially by uncircumcised men. If you have a foreskin, you should gently pull it back, cleanse underneath, and dry thoroughly. Failing to do this can lead to a buildup of bacteria and skin cells, known as smegma, which may cause infection, swelling, and even adhesions. And yes, there's a link between poor hygiene and penile cancer. It's rare, but if men can't pull back the foreskin and fail to check the skin underneath early, signs may be missed. That said, don't overdo it or use aggressive soaps. The skin of the penis is very delicate. Let mild soapy water pass gently over the region. Rinse it well and pat dry. Avoid scrubbing hard or using strong fragrances. Type 1 in the comments if you're finding these tips helpful, and make sure to hit the like button too. Let's keep going. Number 4, don't ignore pain, bleeding, or visible changes. If you notice pain during intercourse or urination, or discover a lump, sore, or blood in your urine, don't delay. These may signal a urinary tract infection, an STI, kidney or bladder stones, or, in rare cases, cancer. I understand these topics are uncomfortable, but early diagnosis makes all the difference. If your doctor judges you, find a better one. You deserve care without shame or blame. Number 5, stay in control and prioritize safety during sex. Nothing is more attractive than confidence and caution. Protection doesn't just lower risk. It also helps you relax, enjoy, and remain fully engaged without anxiety. But safety also requires physical control. Penile fractures are real, and they are surgical emergencies. If your erect penis bends abruptly during rough sex, especially from accidental impact or thrusting at the wrong angle, the outer tissue can tear. You'll hear a pop, feel sharp pain, and see swelling or bruising, what we call eggplant, deformity. If that occurs, head to the ER immediately. Quick surgery gives the best chance for full recovery. Waiting too long can cause permanent erectile dysfunction. Use lubricant liberally. It reduces friction and lowers the chance of injury. And keep in mind, lack of lubrication doesn't always mean your partner isn't aroused. It might be caused by hormones, medication, or stress. Lube benefits everyone. Number 6, don't overheat the area. Testicles hang outside the body for a good reason. They need to remain cooler than your core body heat to produce healthy sperm and testosterone. Steer clear of extended exposure to wet heat, like hot tub saunas or placing a laptop directly on your lap. Also, avoid keeping your phone in your front pocket when you can. All of these habits can harm sperm quality and hormone balance over time. Number 7, be gentle when masturbating. If you apply too much pressure or grip too firmly, your body may become less responsive to regular arousal. This is known as death grip, and it's one of the most frequent reasons for reduced sensitivity and delayed ejaculation. Number 7, don't train your penis to prefer your hand. Let's be honest, rough solo habits are one of the quietest erection killers out there. If you're using a tight grip, moving too fast, or relying on intense pressure, you're teaching your body to respond to artificial stimulation, not real intimacy. This leads to something known as death grip. It reduces sensitivity, delays climax, and makes it harder to stay aroused with a partner. Here's the truth. If solo time feels better than sex, it's not a compliment to your technique. It's a warning sign. Instead of tweaking the method, the smarter move is to take a break. Give your body a chance to reset. Let real intimacy become the main source of pleasure again. Your erections and your relationships will thank you. Number 8, don't smoke. And care for your physical body. Smoking is one of the quickest ways to harm the blood vessels in your penis. It's strongly associated with erectile dysfunction. It also raises your likelihood of bladder cancer, one of the most dangerous, challenging to treat cancers in urology. Your lifestyle counts. A healthy diet, frequent exercise, and managing stress can protect both your erections and your longevity. Number 9, be gentle with yourself. This might actually be the most essential one. Men frequently attach their self-worth to their sexual performance. But honestly, everyone has rough days. If something doesn't go as planned, don't spiral. Don't blame yourself. The stress and anxiety you carry can actually make the situation worse next time. Starting a cycle that's hard to escape. Your body isn't a robot. It's human. Talk to someone you trust, or speak with a doctor. You are not alone. And lastly, number 10, use it or lose it. Sort of. When you stop having erections, whether from stress, relationship challenges, or health issues, the body may begin to restrict blood flow to that area. You could lose sensitivity, experience mild shrinkage, or even develop scar tissue. Nighttime erections are the body's built-in method of preserving penile health. If they completely stop, that could signal a deeper issue. Intimacy and sex are vital for pleasure, emotional connection, and physical well-being. Even without constant stimulation, healthy blood flow is essential for function and strength. But that doesn't mean turning to solo habits. True vitality comes from caring for your body, managing stress, and fostering real connection. So yes, protect it, safeguard it, respect it. Your penis deserves better than myths and misinformation. Pause and hit that subscribe button. If you haven't already, we post clear, practical health tips for men who want to feel stronger, perform better, and live with confidence. We love hearing from you. What part of this video was most helpful to you? Drop your questions, experiences, or thoughts below. Your comments inspire us to keep creating real, healthy content and help more men take charge of their well-being. If this helped you, type 1. If not, type 0. Your feedback tells us what to cover next. Share this with a friend, partner, or a loved one, because real health should never be kept secret. Thank you for watching. Stay informed, stay confident, and always take care of your health. You're worth it.